I was an avid smoker, a heavy smoker for quite a long time. I've been stopped now well over 25, nearly 30 years, but it didn't alter the fact the damage had to a large extent been done, because I started having breathing difficulties, and at that stage I was told that 2/3 of my lungs were starting to harden, so there was only really 1/3 that was fully operational. When I was finally diagnosed with cancer, it just happened to be in the third that was working okay.
Radiotherapy is a treatment that would use X-rays to essentially kill cancer cells and hopefully palliate any symptoms and ultimately cure patients of their cancer.
I think I've been extremely fortunate that I didn't have to have surgery, that I had got the option of an intensive course of radiotherapy, and that of course it's been very successful. On the ward that I shared with some other chaps, some were not quite so lucky. They didn't all have the same sort of treatment that I was having.
With radiotherapy, the crucial step now is the planning of the treatment. When we're planning treatment, we're able to model the dose of the radiotherapy now very closely to the size and the shape of the cancer. These techniques can identify the areas of lung that are still working, and if we can identify those areas, we can model the radiotherapy treatment to avoid them, and that should reduce the chances of the patient suffering any breathing problems or worsening of breathing following the treatment. The combined MRI-PET scanner makes it much easier to produce the images and merge the images together so that we get both data sets, if you like, the tumour data set, so we know what our radiotherapy target's going to be, and the normal tissue, the lung data set, so we know which bits of lung to avoid. The patients who we can already treat satisfactorily, we will treat better and reduce the chance of any long-term effects on their breathing. And I think it'll also potentially open the door to a group of patients who we can't currently treat because the risks of lung damage are just too high to contemplate.
The radiotherapy was successful. I still get breathless, but I just think that's part of the damage that I'd done through smoking. So I just get on with life now, and I think it's great.